Hello, I'm Tanya Dunlap with Perio Protect, and I'm really happy to be with you today. We are going to be talking about a five-step case presentation model that you can use to help patients understand how important it is to get their gums healthy, how important treatment is without a sales pitch, without high pressure. It's really by the numbers, literally. We have data points, bring it all down to simple facts. Our goal for patients, of course, is to put the disease into remission, prevent its reoccurrence. And the reason we're going to focus on bleeding points as our simple facts are because we know that when we can get the chronic infection inflammation under control, it's a highly accurate predictor of no further periodontal damage. We should already have this data. If you don't have it in your records, it's easy to assess. It's fast. It's not painful for your patients, and it should be in there. So let's do it. The trick is educating patients. We live in a highly overstimulated world. It's hard to get their attention. And there are a lot of people who need this information. We have an epidemic of periodontal disease in our country, in our practices. So, how do we get them to focus on this and how do we catch their attention with bleeding? Well, the number one thing you can do that will benefit your patients is just even diagnosing infection and inflammation so that they can make an informed choice. But most people don't understand that the gum disease is actually serious, right? Or what it is. It doesn't hurt. So let's put this into perspective. If you have high blood pressure, right, it typically doesn't hurt in the early stages either. You can't always tell you have it. How do you know? You know because you can measure it. How do you know if you have high blood sugar? If you're a type 2 diabetic, you have a measurement. You want your A1C, that long-term measurement of blood sugar, to be under 7. How do you know if you have high cholesterol? Well, there are numbers, there's measurements for it. Let's give them a gum score. Let's give them a way to measure their gum health. And the gum score is based on the number of bleeding points in their mouth. And the patient wants the lowest number possible. 0 would be ideal, but anything under 10 would be considered healthy. What you're looking at your screen now is some patient-facing marketing that we've done, and we have a whole campaign for you in the brand folder. Happy to let you know where that is. Just give us a call at Perio Protect and we'll get you set up. This patient-facing material is designed to get patients' IQ up about their dental health so that when they come and sit in your chair, they want to know what their numbers are. So you want to decrease your gum score with Perio Protect. The gum score is based on the number of bleeding points in your mouth. You want the lowest score possible. Perio Protect trays deliver medication deep under your gums, help fight the infection that causes the bleeding. So let's go through this 5-point model, this low pressure case presentation model. Step number 1, I am concerned that you have a high gum score. Your gum score is 68. This means that there are 68 areas in your gums that are bleeding and infected. The ideal score is 0, but anything under 10 we would consider healthy. You can make it 10% if you want. We like 10 BOP. Some groups say 5, some say 8, 2 per quad. Your number can be whatever you want. But I've done a lot of market research on this, and there's general consensus with over 3,000 people responding that 10 is a good number. So the ideal score is 0. Anything less than 10 would be considered healthy. I know you're trying hard at home. Be sympathetic. This gets them off of the defensive. They can hear you if they're not defensive. The problem is that your toothbrush, rinse, and floss, it just doesn't get deep enough to fight the infection. Your solution. That's why we prescribe Perio Protect trays. You use them at home. They're super comfortable. They gently deliver the medication deep below your gums and hold it there long enough, just 10 to 15 minutes to fight the infection. The bonus, not only will you have healthier gums, you're also going to have whiter teeth and super fresh breath. 5 points. I am concerned. Your ideal gum score is 0. Anything under 10 would be considered healthy. I know you're trying hard at home. Toothbrush, rinse, and floss just don't get deep enough. This is why we prescribe Perio Protect to describe what that is. Not only will you have healthier gums, you're going to have whiter teeth and super fresh breath. Now, some people are going to say yes right away. Other people are going to say, I need some time to think about this. Terrific. I understand your position. I'm glad you are considering treatment. Because the situation is not healthy now, what can you do differently at home now to try to improve your health? We are not talking here. We're letting them respond. Give it some time. It can be uncomfortable. What can you do differently at home now to try to improve your health? A lot of people are going to say, I'll brush a second time, maybe for 2 full minutes. Some people will say, I'm going to start flossing. Terrific. These are good steps. I'm going to write them down. We're going to score your gums when you come back. And you know it's not going to get much better, but they need to make a decision. This is their body. They get to make the choices. You might also add really important information based on their health history or how many restorations they have in their mouth. Let me know if you have any questions before your next appointment. I'm especially concerned about you because this chronic gingival inflammation, the chronic infections in your gums can compromise your crowns. Typically, we have to replace your crowns over time, but if we can keep that tissue healthy around it, we talked about those infections, if we can keep that tissue around your crowns healthy or around your implant healthy, it'll last longer. Or let me know if you have any questions before your next appointment as you consider treatment. I am especially concerned about you because these chronic infections and inflammation in your gums can make it harder for you to manage your blood sugar as a type 2 diabetic. Or I see that you have a health history of cardiovascular disease. It's really important you consider treatment. Let me know if you have any questions before. I would be especially concerned because these chronic infections and the inflammation in your gums can actually cause inflammation in your arteries. You're just giving them facts. You're not trying to make them choose anything. They can't make a decision if they don't know they have the infection and the inflammation. So that's the most important part. We boil this down. I am concerned. Your ideal score is, I know you're trying hard at home. That's why we prescribe Perio Protect. Not only will you have healthier gums, you're also going to have whiter teeth and super fresh breath. And no, you are doing a tremendous service for your patients because research shows that the treatment of periodontitis is associated with improvements in systemic health outcomes. If you want more information about this research, if you want to practice the 5-step case presentation model or responses when patients want to delay treatment, give us a call at Perio Protect. We'd be really happy to work with you.